Hi friends, today we are going to discuss a very common issue which concerns our eyes and affects all of us: redness, burning, irritation, tiredness. I am Dr. Kapoor. I am a professor in the medical college and an eye doctor, and hope to discuss and clarify your doubts regarding this. So friends, a very typical situation is parents bring in their daughter or kids and the child has got red eyes, watering eyes, little bit of swelling, and it's nothing that happened. It's continuous process. Maybe for the last 1 month, 2 months, they've been going to the local family doctor and it doesn't get solved. So this typical teenager of today even doesn't communicate. They just message, text. So one part of their life is that they are continuously on the small screen. These screens are typically easy to look at, easy to use for a short time. But as far as the eyes are concerned, they are not the best medium to see for a long time. But in today's life, the teenagers are texting, come down, I have reached, they don't call, they don't talk. So this lot of screen time, lot of studies, they are competitive from the 5th standard, 10th standard, 8th standard, tuitions. So all that is reading work, near work. So what finally happens is that we have come to a conclusion that it is a situation where the eyes are normally bathed in tears, and the tears keep it nice and lubricated and moist. And this prolonged, continuous work on the tablet screen or their classes, tuitions, etc., disturbs this tear film. And this is what in medical terms we say dry eye. And of course, we give them the drops and some treatment, some lifestyle changes for that. And that solves the problem. This is a very common scenario, I think, in everyone's house, and we have all experienced it. So second example today is a young executive, maybe 25, 30 years old, man, woman, going to work. And in any busy metropolis, the commute itself, the pollution, if they have got a bike, they're 25, 30, their first vehicle, and the immense pollution on the road, the exhaust from the trucks and all this. Second thing is that they are on 24 hours. They are answering emails all the time. I see people in the building get out of their house, get into the elevator, and they are answering. They get out of their office cabin, they get into an elevator, they are at the coffee station, they are texting. So combined with this tremendous amount of being online all the time, and work-wise, commute-wise, pollution-wise, any city, you know, the air quality is being discussed. Tremendous pollution, tremendous poor air quality. And then you need entertainment also. The entertainment is in the WhatsApp, that's on the screen. So even when they are taking a break, they are looking at a video, they are looking at a mobile screen. So the entire life is now dependent on the eyes being used for your work, for your entertainment and all. So these type of people have got confusing complaints, eye ache, difficulty at sometimes with seeing the computer monitor, redness, irritation, dryness, grittiness. With girls, there's an extra factor of their mascara, kajal, makeup, eye makeup. Today they have a lot of options, and sometimes the chemicals, the quality can, in a particular batch, even though they are used to the same type of brand for so many years, can be a problem. So these things are all disturbing the tears. It's dry eye. You might go to a doctor and he'll check you, we check with a Shermer strip the quantity of dry eye. You don't have a deficient quantity of dry eye. That tears has become dirty, mucky with all the pollution in the environment. So it's the quality of the tears that has causing a lot of complaints. Second is the fact that you look at a screen, you don't blink. So the tears, blinking circulates the tears. So the circulation is affected. Like you see in a gutter, if the water doesn't move, it becomes dirty. So movement of the water is important. Because you're staring at a screen, because you are staring at your mobile or you're texting or emailing, the circulation of the tears is affected and it is causing poor tear quality. This again needs proper treatment, proper lifestyle adjustments, and you should consult preferably a local eye doctor. So a common thing today, almost 50% of the world wears glasses. If you can't see it, it's because another 80% of them wear contact lenses. Contact lenses is a piece of plastic lying on the cornea. The cornea gets its nutrition from the atmospheric oxygen. You have kept a piece of plastic on it and that causes a lot of problems. That lens also lying in the eye for hours together, years together, causes ultimately even dry eye. So what can be done? A common solution will be use it as less as possible. You come home, remove it first thing. Okay? You wait till you just leave for work to wear it. You're going for a party, wear it just when you're going. As soon as you come home, get it. A lot of people will be having medications for other diseases that sometimes can cause dry eye. You should check with your doctor and if required, take additional treatment for the eyes. There are a lot of older people who have disease like glaucoma. They take drops lifetime. The drops themselves have chemicals, preservatives, and one has to be sure that your doctor can guide you that requires treatment because of your previous medication. 20-20-20 rule, every 20 minutes take a 20-second break and don't again look from your computer to the mobile, from the work to the WhatsApp video. Look at something about 20 feet away so the eyes don't have to focus, and frequent washing of your eyes. All the pollution of the atmosphere, if it's simply washed out 4 or 5 times a day, should go a great way. When you're outdoors, I think everyone should wear, it's not a sunglasses, but a sunglass to protect you from the atmospheric pollution. So it need not be dark, it can be something that can be worn outdoors, with less sunlight, more sunlight. And simple things like this should help you go a long way. So last, what can we do in practical life? I think a healthy, nutritious diet, lots of vegetables which give us enough amount of vitamins, adequate exposure to sunlight. And as far as the tablet time is concerned, I remember reading about Steve Jobs of Apple fame, who invented the iPad. And the journalist or friend asked him that how your children must be really enjoying the iPad. And his reply was, no, I'm sorry, in our house, we have restricted children from iPad and the timing, the amount of time. So it's a wake-up call for all of us who are happy to just put an iPad in front of the child who's crying, who's throwing tantrums, and reduce the screen time habit from childhood. And lastly, the eyes are very sensitive. Even a contact lens solution causes so much. So some types of self-medication, home remedies, I would advise you to be careful with it. And if there is any problem, consult your local eye doctor. Best of luck. Thank you.